Hello and welcome to everyone that has just logged on to this webinar. I'm Dr. Sarah Scharf, and we are going to spend about the next hour or so going over the details of a live talk that I typically do throughout the Bay Area on thyroid dysfunction and getting to the bottom of things and addressing the root cause of what's happening with a thyroid when it's either low or high, hypothyroidism or hyperthyroidism. So a little bit about me, and I think probably the first thing you want to know is that I'm a functional medicine practitioner, and that means that my approach here is not about adding another medication to you. It's the last thing that's actually outside of my license. I can't do that, but it's completely outside of my interest. I'm absolutely not going to be extending quick solutions to lower or raise or manage a thyroid with some sort of shiny new medical device or new invention. So that's definitely not where we're taking things today. And to give you a little bit of background, as a functional medicine practitioner, that's really, we're really looking at way beyond traditional symptoms of health dysfunction in general. And so we're looking way beyond the symptom to the underlying root cause. And my clinic here in the Bay Area primarily deals with two communities, and the first one is the thyroid community, and the second community is the diabetic community. And really it came about this way because those two communities are really the most underserved in the Western medicine model. And so I think those two groups have just naturally been very attracted to our practice because we're helping them understand what really unique root cause of thyroid issues, and for those in the diabetic community, diabetes in general. So I think that the way I want to start out this talk for you guys is in a real simple way. I want you to have a certain expectation for the next hour. And I think that's fair. And you're going to set aside an hour of your time to hopefully listen to this workshop in its entirety. It's really good information for anybody suffering with a thyroid issue. But what your expectation should truly be, and this is coming from an individual myself, I'm very much a realistic person. I'm a realist. I'm not an optimist nor a pessimist. I really believe in giving information just straight up, without an upswing or downswing to it. So coming from a realist, what you should expect for the next hour is really to be blown away. And what do I mean by that? I expect, no matter who's listening to this, if you have a thyroid issue yourself, or if you have a loved one that you're listening on behalf of, I expect you to be blown away. And so what do I mean by that? Really, you're going to be blown away that you haven't gotten this information before. You're going to be blown away that you haven't gotten this information on the very first day that you were diagnosed, nor subsequent visits. And I am a huge fan of, Western medicine for certain situations, acute care, crisis care. You have a heart attack, you have a car accident. Don't come to my office. You want to get in to see, a Western medically oriented individual. But do you want to see that person to actually restore your health? And there, we all do what we're trained to do. And those individuals are incredibly talented, really good people whose hands, in my opinion, are tied to really turn around and heal, particularly in the thyroid community. So what you're going to really get an understanding of today or tonight, whatever it might be for you, is first of all why your labs look fine according to your doctor, and why you have a slew of symptoms. And You'll understand that. You understand basically why you feel terrible and your labs look fine. We're going to talk about why 90% of thyroid patients, their ailments have actually nothing to do with the thyroid itself. And we'll talk about what that means. Yeah, you heard me correctly. 90% of you guys that have thyroid issues, it has nothing to do with your thyroid. And I'm going to be going over what that issue is and how you address it. But really, ultimately, yeah, I do expect everyone to be blown away and to get real actionable information and kind of an aha moment on, wow, no wonder I'm feeling the way I am. All right. So let's get started. And the way I want to begin things is kind of a basic education. It's really important to understand why the thyroid is so important. And ultimately, what you want to know is that the thyroid hormone is really the only hormone in the body that every cell needs. Okay, let me say that one more time. It's the only hormone, the thyroid hormone is the only hormone in the body that every single cell needs. Now, actually, an exception to that is a red blood cell. The red blood cell does not need thyroid. But other than that, every other cell in the body needs thyroid to function well. And so you can imagine if your thyroid is either really low or really, really high, how far-reaching that's going to be. It's going to impact quite a few systems across the board. It's different for everybody. So the first system that we're going to be seeing, the first few systems, the bone metabolism. And bone metabolism is altered with somebody with a thyroid issue because thyroid is essentially a key component in the osteoblastic activity, which is basically the bone, setting the bone building tempo in the body. And so when the bone building tempo gets thrown off, it doesn't build bone so well. It's really a lot of research connecting osteopenia, osteoporosis with thyroid issues. The next system that it supports is the immune system. So it's really common that we'll see individuals with really susceptible to viruses, and particularly getting upper respiratory viruses, and UTI is really common. Another common area in the system that you'll see symptoms related to is the brain and the nervous system, and that typically shows up as that classic brain fog. You can walk into the kitchen and kind of stare at the fridge and wonder why you came in the kitchen in the first place, or you went out to dinner with some old friends last night and you can't for the life of you remember their name. So that's brain fog. And so many of us attribute that to, I just turned 40 this year and, I'm going to forget some things. But really encourage people to be honest about that reality and that decline cognitively, because it's an indicator of early on neurodegeneration. And that's one of the first symptoms I'm happy to report. It's different for everyone, but I'm happy to report it's pretty regularly, pretty quickly turned around for thyroid patients once they get the underlying issues handled and that thyroid hormone starts becoming well distributed throughout the body. GI function is really commonly impacted in a thyroid patient because when you have an imbalance in the thyroid hormone, it throws off the digestive enzymes. They're really not very well produced. And as a result, your GI system gets really inflamed. And that translates to IBS, constipation. It translates to just a whole host of GI issues. The liver and the gallbladder are impacted. Without the thyroid hormone in a good place, you see very, very sluggish liver and very sluggish gallbladder. In fact, the stat is about 2 to 4 times. You're about 2 to 4 times more likely to see a gallstone attack if you're having thyroid issues, and you'll see a lot of liver clearing issues in thyroid patients, and we measure that through tests. In our practice, we do a stool test with all of our thyroid patients to understand how healthy their GI system is on a functional level. So growth and sex hormones are always impacted. And that really shows up as low libido across the board, male, female. It also shows up with just challenges for females with their monthly cycles. The miscarriage rate is much higher for individuals with thyroid challenges as well. Fat burning. So really common for patients that I meet with initially, and to share the pain that they're having related to just an absolute inability to lose weight, no matter how good they are. They could be eating like a rabbit and just working out like a fiend, and they could either have no change in their weight, or they could be layering the weight on over the years. And I literally see tears shed on this front, and a lot of confusion and frustration. And what happens with the thyroid imbalance is that hormonally, the fat burning hormones are essentially turned off, and the fat storing hormones are turned on when there's a thyroid imbalance. So it has really very, very little to do with your calorie in, calorie out reality, but it's all about the underlying hormonal reality. And again, when the thyroid is particularly a very low thyroid, hypothyroid, you are not set up hormonally to lose weight until that gets balanced. And it doesn't matter if you're on a medication, a levo or Synthroid, you're still going to be having metabolic issues, and I'll explain that to you a few slides in here. So the insulin glucose metabolism is impacted with thyroid imbalances, and I think I mentioned earlier about our practice being based with approximately half of our diabetics and the other half are thyroid patients, and easily 30 to 40% of our diabetics have a underlying thyroid condition as well. And that overlap is there because when their thyroid is imbalanced, it impacts your body's ability to manage insulin and glucose metabolism. So as a result, it's a very slippery slope for hypothyroid patients to be prone to glucose issues and insulin glucose management issues. So the likelihood that the diabetic process is going to kick in is considerably higher than an individual that doesn't have a thyroid imbalance. Cardiovascular health, 2 to 4 times more likely is the research for someone with a low thyroid to have a heart attack. And that's because there's a correlation with thyroid imbalance and the increase in triglycerides in the body. So and I say this out of an intention to educate, not to scare. And I really want you guys to have this data that's completely housed and grounded in current research and current findings. So cardiovascular health is absolutely put at risk with a thyroid imbalance. And then the last piece are healthy vitamin D levels. And healthy vitamin D levels are put at risk. Vitamin D is absorbed in the gut. And our patients that we see, we always measure vitamin D levels and work on restoring that, but with our patients. But the vitamin D just really has a tough time getting into the body because of a thyroid patient's inflamed GI system, and the inability to absorb vitamin D is really impacted. So you can see there's quite a few, basically the thyroid supports every cell in the body and every system in the body, and these are common areas of dysfunction that we see. And it's pretty common when I meet with new patients, because we meet for at least an hour, and I get every little detail of symptom or history in their health that they're willing to share. And a lot of times patients look at me and they say, I was always really a little bit nervous about sharing all these symptoms I have with my primary MD, because I was afraid that he would just roll his eyes or think I'm crazy. So it's really common for thyroid patients to really kind of feel like they're coming unglued on many fronts. And this is why. It's a physiological reality that the thyroid is required in every cell of the body. And when it's not there, things go awry. So I'm just going to click through just visually here. So there's a few other symptoms that you guys, I just want you to understand that chances are if you have a thyroid imbalance and these other symptoms going on, when you restore that thyroid balance, that we see these symptoms resolve. So again, bowel difficulty, hair loss and thinning, coarse, dry hair has a lot to do with the inability for essential fatty acids to move throughout the body as well as into the follicles. I'm happy to report that the hair thinning and the hair loss does return, and it takes time, but it does trend backwards and trend back in to a more full, thicker head of hair over time. And of course, it depends on how old you are, how long you've been dealing with the imbalance, but that is a process that we see more likely than not restore for individuals. Morning headaches that kind of resolve. You kind of wake up with a headache, and over the course of the day, it kind of lightens up. That's a thyroid issue. Depression, very common that a thyroid patient will be experiencing depression. And what's really tough to hear is that these patients of ours certainly share this reality with their doctor, and what's very, very quick to come out of that meeting is a prescription for an SSRI. And it's tough, and I can, again, the medical doctors really just following their processes and what their training is, but depression, once the thyroid balance comes into play, we see that lift. Energy, mojo in general, very, very low. And we'll talk about that in a few slides about why it's so low. But, I have a lot of patients that happen to be moms with all different ages kids, young kids, high school, college. And so often they're told, hey, you're a mom. What do you expect? You're going to be pooped. And that's hard. That's hard to hear that that's happening as a justification with someone that is having a thyroid imbalance, because it doesn't have anything to do with that. And you can be a very energetic, present mom. It's there. It's there for you. I'm sure you might need a nap every once in a while, but it's not necessary that you need really have that day-to-day just very, very low energy state. Weight gain and inability to lose weight, I talked about that earlier, about the fat burning hormones with a thyroid imbalance are turned off, and the fat storing hormones are turned on. It's like a switch, and it's nearly impossible to make a dent in your weight with that imbalance. Hot flashes and night sweats, those are escalated with a thyroid imbalance. Insomnia, really common. What we do is we look, in addition to thyroid kind of levels, we're always looking at adrenal fatigue and level of adrenal health with the thyroid patient. The reason you have to do this is that it's so common for the adrenal functionally to kind of come into play when there's a thyroid dysfunction. And what happens is that the adrenals start getting tapped into and involved in the imbalance of the hormone distribution. And it's kind of like when the adrenals get pulled in and they start getting tapped out, it's literally like you have two drivers in a vehicle. And the aftermath is pretty chaotic, and that you see as a result the adrenal system and the thyroid system kind of duking it out with one another, and it's very, very common to see insomnia as a result. So with all of our thyroid patients, it's really important to get a thorough workup on your adrenals, and if they are fatigued, support them and bring back the circadian rhythm, and we do that through saliva tests. Cold hands and cold feet, it's a circulatory issue. We also see in it, on top of circulatory issues, we'll see dry, scaly skin, kind of having a flaky skin. Again, on that front, it's just the circulatory system of the body isn't very strong, and you see that cold hands and cold feet. Mood swings affecting relationships. it's almost rare that I meet an individual with a thyroid issue that isn't having mood swings. And the thyroid has a really intimate relationship with the progesterone hormone. And essentially what it does is it makes, when you have a low thyroid, it kind of heightens the sensitivity of the cell receptors on the progesterone. And it creates an instability. And you see increase and decrease and swings in progesterone levels with individuals with thyroid. So it's not in between your head or in between your ears, but this is a physiological reality, the mood swings as a result of the thyroid dynamic with progesterone. Nervous, emotional, and anxious. A lot of anxiety and heightened emotional response with individuals with thyroid imbalance. And again, let's go back to that, just an overall weakness, energetic weakness, dry, rough, pale skin. It's pretty common to get muscle cramps and aches. Has a lot to do with actually inflammation and the body's GI system and its inability to process toxins. Abnormal menstruation, like we talked about that before, decreased libido, and elevated cholesterol. So, and what's being done? It's a standard medical treatment is focusing on taking a pill to replace the thyroid hormones imbalances, or to kind of old schools to do radioactive iodine to actually remove the thyroid, just take it out. And this is based on a 50-year-old model. Things have not changed for 50 years on how primary MDs are treating things. And again, this is not a knock on the primary MD. We do what we're trained, and that's just what we all do, that in all areas of life and professionalism. So they're being trained by pharmaceutical reps on the ability for pharmaceutical drugs to take over and replace just a crucial part of a body process that really there can be a lot more done to restore that function outside of taking a pill. So I'm going to walk through a little bit of this thyroid metabolism with you, and kind of bear with me. It looks a little I don't know, possibly a little overwhelming, but it's really not. It's really straightforward, and it's important that you guys understand a big part of our mission, here in this functional medicine clinic, is to empower our patients. And our patients are educated on how to speak to their doctor, how to, communicate what labs they need and why. But you need to kind of understand the big picture. So the thyroid metabolism, a lot of us, are aware that the thyroid is this little butterfly gland kind of right in the middle of our throat, and would possibly, and understandably think that the metabolism begins in that gland. But it doesn't. It's beginning a level above that in the brain. And the communication cycle begins with the brain having a conversation with the pituitary, and the hypothalamus, which is within the brainstem. It sends something called thyroid releasing hormone, TRH, to the pituitary gland. And that's just simply a message saying, hey, let's start making some thyroid hormone. The pituitary is this master gland, and it is managing really quite everything in the system. The pituitary turns around, has a conversation with the thyroid, so the pituitary speaks to the gland, and it releases thyroid-stimulating hormone to stimulate the thyroid gland. So thyroid-stimulating hormone is kind of the de facto point of measurement in conventional medicine. And you guys will, in a minute here, will understand why that is just grossly just not enough. So the thyroid hormone production, TSH, turns around, stimulates TPO, an enzyme, to create T4 and T3. Some of you might be familiar with T4 and T3. So the way you want to think about this metabolism is it's almost as though it's one of those relays where a baton is getting passed. Remember those relays where someone would run a lap and then hand it to the next person, and then that person would run a lap and hand it to the next person. And the idea was not to drop that baton. In some races, I think you were disqualified if it got dropped, or you lost a lot of time. And it's the same thing in this metabolic pathway, and that there's points of conversation within the body where there's vulnerabilities for the baton to get dropped, and there's vulnerabilities for that communication to get thrown off. And you need to test if these points of communication are happening within your body. And you can test for this. We test for this every day in our practice to ensure that your body is having the right conversation at the right place at the right time, and these hormones are getting produced in the accurate and in the right time frame. So the thyroid hormone production, again, TSH stimulates TPO to create T4 and T3. And from my experience, a lot of people are kind of familiar with this T4 and T3, but let me simplify it for you. So the thyroid is going to produce T4 and T3. And on average, on average, essentially the majority of that hormone, 93% is T4 and 7% is T3. How you want to understand this is T4 to the body is like crude oil, okay? As crude oil would be to a vehicle. And T3 is pure gasoline. And so it's very usable. And they call it metabolically active hormone T3, and T4 is metabolically inactive. So gasoline is what the body can use in the same way that the car can use. So T3, that's what every cell in the body needs is T3. Okay? It's not much more simpler than that. However, the amount that's produced by the thyroid, it's not enough. It's not enough for every cell in the body. So how do we get more T3 in the body? By T4. T4 converts into T3 in a healthy pathway system, in a healthy GI system, because where it converts is predominantly in the liver. And I don't care if you're born and raised in, an incredibly liberal and conscious and aware community for food and nutrition. Standard American diet sneaks in, and our GI system just through life gets sluggish, not only from diet, from nutrition, but also from environmental factors, and certainly from cortisol and stress in general. So there's a lot riding on your gut and its ability to take T4 and convert it into T3, into an active, usable format. Now, these different metrics you're going to go through where it says 60% T4 converts to T3, 20% of peripheral tissues go into 20% move into peripheral tissues T3. There's another 20% that's inactive. That's 20% that essentially can't be utilized ever, and then that sum moves into free T3. So really, in the thyroid panel, you need to look at quite a bit more than TSH to understand. So at a minimum, you need to look at T3, and you need to measure for T3. Particularly the active T3, and you also want to understand how much of it is free T3, and then you want to understand where the T4 component is. So a full comprehensive thyroid panel has at a minimum 8 metrics that we look at so we can understand where the baton is passed, and where it's dropped, and how well is the body at converting T4 to T3. So I'm going to kind of scoot back here so you guys can see this. So I don't think I mentioned this. 3 common reasons why these pathways fall or fail or just get diminished in the body. The number one cause is, or a very common cause, is cortisol levels. The second cause for a drop in this communication is inflammation levels, and the third are undiagnosed infections throughout the body. So we have to measure and understand, are the links kind of being essentially broken or deteriorated, the communication in the brain, in the pituitary, and the pituitary to the thyroid. We need to look at that and those 3 markers. And then on this thyroid side, we need to understand how well the body is at converting T4 to T3. And let me help you understand something too. When you guys are getting tests, when you guys are getting tested and your labs are run, and the doctor's looking typically at TSH and T4. So levothyroxine, that's T4 medication in general. So they're giving you T4. Okay, they're giving you synthetic T4. And they're measuring for what? They're measuring for T4. So they're giving you what? T4. And they're measuring for what? T4. So do you see why when they're measuring for T4 that they're completely happy with your level of T4 because they're giving it to you? Right? That is why you have a tremendous amount of symptoms, yet your labs, incomplete labs at that, a T4 lab, is normal because you're not looking at the whole puzzle. You have to understand at a minimum what's happening in T3, and then all along the way between the different pathways with how well that communication is going. And you can do that. You can find out if the baton's getting dropped. You can find out how well your gut's doing. And you can find out what are any other issues that are impacting your body's ability to convert T4 to T3. All right. There's a lot in your control. I hope you guys get that from this. Hope this was helpful. So the next piece I want to move into is really having you guys understand lab tests and how that is being approached and how that's being looked at. So first of all, I want you to understand, I want you to kind of answer one question for yourself. Lab tests in general, who out there in the community in general is getting labs done on a reoccurring basis? Those people that are well or those people that are not so well? It's those folks that are not so well that are getting their labs done more frequently than those folks that are well. So what's happening is that the lab result, as a result, the lab ranges are inaccurate, because if you ever looked on those labs and if you're like most people, you look for the H's and the L's, the highs and the lows, and right? And so high and low compared to what? It's high and low. Your labs are being compared to the high and low of that geographic region, which is why you can be a diabetic in Arizona and not one in Tennessee. Typically, it's the other way around, actually. And I don't know about you guys, but I would want my labs to be compared to the well people. That's who I would want to be compared to. And so from a functional standpoint, we do that. Functionally, and on the next slide we'll explain it to you, we do not, bell curves, we are not using bell curves, and our functional optimal lab values are much more sensitive to reveal problems versus simply comparing your labs to a whole bunch of other people in your geographic region that are getting a bunch of labs done at the same time. Okay? So that concept is something called a functional lab assessment. And this is available for everybody. And it is, in my opinion, how I would want my friends and my family and my community to look at the science of how well they are individually. So this is an example. This is TSH marker, and incidentally, you can look at markers all across the board in this way, not simply just a TSH marker. So we look at liver enzymes in an optimal lab range. We'll look at blood glucose levels. We'll certainly look at inflammatory markers. It just goes on and on and on. So we're looking at every single marker in the body that you can measure in an optimal lab range. And so let me get a little bit more specific about what that means. So TSH, okay, TSH is optimal. There's an optimal range. It's called a functionally well range, anywhere between 1.8 and 3.0. And so we look at our patients' health and degree of well functioning status on where their optimal lab ranges are. So we would want someone's TSH to be anywhere between 1.8 and 3.0. So what happens though, and specifically maybe closer to around 2, And we don't really want this TSH to get up to 2.8 or 2.9, nowhere near. Because what happens when it gets up to 3.0? That's when you're diagnosed with hypothyroidism. But what typically happens when you're getting to about, when your labs say, maybe before you were diagnosed, around 2.8. So what happens is that the doctor typically says, drug prescribing doctor says, wow, Mary, okay, this is on the rise. Let's watch this. And my first thought is, well, let's watch what? Let's watch me get a disease? No, thank you. I used to live on a very, very busy street, 4-lane street. Fortunately, I just lived there a very short period of time, and I have a 6-year-old son. And this is very similar to if my spouse and I were sitting out on our front, on our front deck, and our son Graham was playing in the front yard, 15, 20 feet from that very busy intersection, and his ball went kind of dribbling out into the close to the road, and he started running after that ball, and it would be this is the very same thing as my spouse and I looking at each other and saying, oh wow, let's watch that. Let's watch him as he runs towards that busy intersection. So you have the opportunity to be much more proactive in your health, and specifically with your labs. And you don't need to compare your labs to all those other people in your geographic region and how well they're doing or how not well they're doing, but you can look at your labs as it relates to a functional reality. So let's talk about a few different causes for the symptoms of hypothyroidism. And in order to get to this root cause, and there's a handful of them, you have to have the proper testing. And that's, in my practice, that's a full functional blood chem panel. That's a stool test. That's a hormone test, a saliva test that is taken throughout the day to collect a accurate circadian rhythm. So you must have the proper testing. So one of the causes for thyroid issue is that it actually has to do with the thyroid itself. This is true for less than 10%, guys. Okay, so that was one of my comments earlier on in the webinar about how 90% of us, the issue with our thyroid has nothing to do with our thyroid. So for 10% of us, the issue with our thyroid has to do with our thyroid. And we can find that out through testing and support that and support the thyroid and get it back to producing the T3 that it needs to. But we have to understand where that baton was dropped. The second issue is that it's secondary to a hypopituitary axis. And the hypopituitary axis was that kind of upstream, that first slide before of thyroid metabolism, of the communication between the brain and the pituitary, and the hypothalamus and the pituitary. And again, we can measure that and understand if that's an issue based on looking at inflammation, looking at cortisol levels, and any undiagnosed infections. So that is a common root cause of thyroid issues. It's not being looked at. Let me actually take a quick quick break to help you understand. So a lot of people ask me, well, Dr. Scharf, why isn't it being looked at? Why isn't the right test being done? And the answer is very simple. The right test is not being done because insurance won't pay for it. Insurance won't pay for it because the doctor doesn't have the tools to address the reason why you've lost, why and what the root cause is. Hope that makes sense. So the testing isn't being done because it's not being paid for by insurance, and insurance won't pay for it because even if they did pay for it, the doctor doesn't have the proper tools to address root cause. It's not in their framework, and it has nothing to do with the character or intelligence of that doctor or competency. Nothing to do with that. It just simply has to do with that's not the model they're in. They're taking care of health through drugs and surgery. So proper testing is a requirement. You could have a secondary to hypopituitary issue, and we get that through the right testing. Thyroid under or over conversion is a common issue, and typically it's a blend of these issues. Thyroid under over conversion just means that the T4 is over converting to T3, or the T4 is under converting to T3. And there's different metrics for why the body does that. And we typically find that out in a combination of a functional blood test and a stool test. TBG elevation from increased estrogen. So the thyroid binding globulin is actually pretty descriptive. It's how the thyroid travels. It gets bound. And if there is an increase in estrogen, and that's typically from hormone replacement therapy and contraceptives, then the body's ability to transport that thyroid and ability to bind is impacted. And we can find that out because we do checks on estrogen, male and female, to ensure that that is at an accurate level. From a functional medicine standpoint, do we provide hormone replacement therapy if there's issues with estrogen? No, not out of the gate. We always look to the body to restore function, to balance the hormone on its own before resorting to overriding that function in the body. Thyroid resistance, that's typically at the cellular level in the body where the cell has an inability, it's overwhelmed essentially, and there's an inability for the cell to take in the thyroid. And we address that primarily through inflammation and reducing inflammation. The sixth primary cause for hypothyroidism, and this is true for 90% of individuals with low thyroid, it's something called Hashimoto's. It's an autoimmune condition. Why is this not being tested for? Well, the answer is simple, and that is because there is no medication for Hashimoto's. Why test for it if there's no way to medicate for it? So conventional medicine does not have any autoimmune protocols, and as a result, they're not testing for it and they're not addressing for it. So this is very big, you guys, and I want to, for those of you that need clarity on what an autoimmune condition is, let me tell you. So an autoimmune disorder is essentially, it's just underscoring that 90% of these symptoms are due to an autoimmune disorder. It's essentially when the body's immune system, kind of a switch gets turned on, and it can happen through chronic inflammation, stress, and it can be hereditary, where the immune system attacks itself and it targets itself as not a good guy. And when the immune system specifically targets the thyroid, that is when the thyroid starts getting destroyed, if you will, or attacked, and it impacts the whole chain of communication. So what you really need to know is that the immune system, in order for it to, so even if you do have an autoimmune, so first of all, you have to find out, do you have an autoimmune issue? Chances are you do. Chances are those of you that are listening to this that are low thyroid, that haven't yet been diagnosed, you need to find out if you have an autoimmune condition. Second, you can quantify how raging this condition is. So think of an autoimmune condition as a wildfire, and it can either be raging or it can be very small and like just little embers, okay? And in order to, let's just look at this for the immune system, just one more descriptor of what this is, how it gets off balance and how an autoimmune kind of response gets initiated is that there's Th2 and Th1. Th2 an aspect of the immune system is where essentially the immune system has markers, and it marks viruses, it'll mark cancer, and it's a really healthy aspect of the immune system to be in good function. And in an optimally functioning immune system, the Th2 cells mark for the Th1, which are those little Pac-Man guys, and the Pac-Man guys just go to town. They eat whatever Th2 marks. In an autoimmune system, Th2 is imbalanced and it overmarks, and that's when the destruction escalates, and from an attack standpoint. So 50 to 60% of individuals with Hashimoto's have other organs being attacked. The biggest reason to confront and to look at the autoimmune condition, if you have it, if you do, how enraged is it, how big is the immune response, is that if that immune response is really high and really strong, the chances are that it can move, it can begin attacking other tissues. And sure, there's a lot of reasons to get your thyroid condition under control. You want for day-to-day just quality of life and living. But a huge reason in my book, possibly even above that, is to ensure that the autoimmune, if you do have one, is calm, because it can be, if your body's functionally well, your autoimmune response is not going to be so high and great. So the big reason is to ensure that that autoimmune condition does not move into other organs. What that looks like is, if there is an autoimmune disease present, that shows up as the pancreas getting attacked. That translates to type 1 diabetes. The myelin sheath can get attacked. That's multiple sclerosis. Parkinson's, Alzheimer's, dementia, all tied to autoimmunity because of the brain becoming attacked by our own immune system. The intestine can get attacked, can get targeted. That's Crohn's, that's IBD. Rheumatoid arthritis. I mean, we have a lot of patients in our practice that just come in to manage their autoimmune so that their symptomology related to these various diseases are calmed down. Rheumatoid arthritis, that's when the joints get attacked. When the uterus gets attacked, that's endometriosis. And then the spine, ultimately, that's osteoporosis. So again, I'm just the messenger, and I'm passing on research that is very real. And you know, you guys, this is something that it's not a death sentence to have an autoimmune. But let me reiterate, the degree to which your autoimmune is in a calm state is directly proportionate to how well functioning the rest of your body is. So you have to go through testing to make sure that your system is in a stable, functional place, and that will dictate how the autoimmune reacts. So let's get to, this is a great slide because it helps me understand and should help you understand how well you've gotten this information. And the question I always ask, especially in these live seminars I do, is what do you guys think? Can you predict the future of your health separate from a communicable disease, separate from an awful accident? So what do you guys think? Yep, yes, no? So it is without a doubt a resounding huge capital Y-E-S. Okay, so, but what's most important is to walk through how can you really kind of take the bull by the horns here with your health and control things. First thing is you got to order the correct tests, and you ask yourself, hey, do I have a complete thyroid panel? Am I looking at all factors in this relay race? Is the baton being smoothly communicated all the way from my hypothalamus all the way down to T3 in the cell level? Chances are no, okay? Has anyone looking if I had an autoimmune issue? If I do, how enraged is that? And is there some vulnerability in my body for it to move into another area of our bodies? And that's quantifiable. We can tell, and you can know without a doubt how intense your autoimmune flare-up is. So you got to start with the correct tests. You have to look at the underlying cause. You guys, this has nothing to do with your thyroid for 90% of you, okay? It has nothing to do with your thyroid. You guys are not your TSH numbers. Focus on the cause and not the symptoms. Does anyone listening to this really, truly feel like the cause is being addressed and focused on? And you really need to correct the dysfunction itself and not alter the labs with drugs. So in our practice, we do an initial kind of benchmark testing, and then we retest about 8 to 12 weeks later after putting together bio-individualized processes for our patients to turn things around. So we know that we're correcting the dysfunction. It's really straightforward. Otherwise, what's being typically done is you're taking Levo or Synthroid or those types of drugs, and it's making your T4 number look good. And the doctor thinks that they're doing their job, and they are, if their job is to just have your T4 look good. But you guys now know that there's a bigger story behind that. Address the body as a whole. systematic approach, a very straightforward approach of what to do when and when to stop what. I'll talk about that in the next slide. And then mentoring. I find that people really heal and make big changes in their life when there's someone that is available to them on a pretty intimate level on, day in, day out, week in, week out, month in, month out, that essentially sees more in that person than they see in themselves. So when you have those factors, those 7 components, can you predict the future of your health? Yes, without a doubt. So the missing pieces, particularly with thyroid issues, I'm going to go through these guys for you. It all starts out with the upfront testing, comprehensive testing. We do our tests through co-op labs, so they're affordable. All the tests that we extend to our patients, our patients pay the cost of the test. And what you kick this off with all of the benchmark testing to understand what's really happening under the hood. We begin with a detox. You gotta clean house before you begin to heal, and detoxes are, there's a lot of different ranges. This isn't something that, you're heading into Costco and buying one of those colon cleanses where you spend the weekend in the bathroom. But this is a very civilized approach to cleaning house, and it's very, very doable. We have to look at nutrition. We have to see what foods uniquely are being fed to you or that you're eating that support so let me put it a different way. Foods that you eat are going to do one of two things. They're going to support a healing process for you or an inflammatory process. And those foods are going to be unique to you. So you need a system to understand what foods are right for you. You have to look at inflammation and bring that down. Inflammation is a precursor to kind of everything terrible out there. It's stroke, heart disease, cancer. We now know that the common denominator is inflammation, and it really throws off the function of the body. So we can measure levels of inflammation, and we have protocols to reduce it and to retest and to quantify the reduction of inflammation. And it has to be looked at. Hormones need to be addressed. Definitely all of the cortisol, circadian rhythms. There's 600 hormones in the body. They just need to be balanced. And we look at that and address that. Again, not through hormone replacement therapy, but through looking at what sort of support does the body need to begin to balance out its hormones on its own. And then the 5th piece is the immune system, and I hope that is very obvious why, but the autoimmune has got to be looked at, and we have to quantify the response and put together protocols to soothe the system and restore health so that that autoimmune response doesn't move into any other category. Okay, so let's go ahead and talk about what it looks like to come in and get a consult to see whether or not your thyroid condition can be helped and what this looks like. So whenever I do these webinars, you certainly have, you being the person on the other end of this, have certainly been educated. And so when I do that, I discount the opportunity to come in and have an assessment. And what that looks like is it's a complete wellness evaluation, a consultation, a 1-hour consultation with me, and a plan of action, a care plan. And during that consultation, it's a very thorough history of your beginnings and what your instincts are on what happened, what went wrong, what contributing factors might be, how you were treated in the conventional Western medicine, your instincts on that, just essentially a thorough health history. So, if you've had a gallbladder removed, definitively know that yes, in fact, it was removed, and the date and the time, not the time necessarily, but the date, and really just other major really certainly chemical history, but also clinical history. So we'll go through that, and then we'll talk very specifically about the work we need to do together and whether or not you can be a phenomenal success. And what I do, and that's typically $287 in my practice, and I drop that for those individuals that have watched a webinar of mine, and I reduce it to $87, just really to act as a catalyst for you. So what you need to do is just give us a call at that number, 415-721-2990, and absolutely mention the webinar special, and because otherwise it would be a traditional consult fee of $287. If you're out of town and you're not in the San Francisco Bay Area, I do phone consults, and I do have about 20% of my practice I've never met. So that is absolutely a possibility. If you are locally but not very close to the Marin County, maybe a few hours away, what I really prefer is to make it to one appointment so that we can meet, because that's ideal. It's not necessary, but that's ideal. If you have a spouse, I'm going to really ideally want to meet them. And at this point in time, I'm not accepting smokers into the practice unless you are ready to quit. So I hope you guys have gotten a ton out of this webinar. If you feel like it's a fit and you resonate with the work that we're doing and you really are done with the Western medicine approach to your health, then absolutely reach out. I would love to meet you. Okay.